Hi, I'm Dr. Sumanth, Chief Physiotherapist, Yashoda Hospitals. As we know, there are many hazards by using this cell phone. Today, I would like to discuss on cell phone hand syndromes. On our clinical practice, we are getting many patients who are having problems with these, who are suffering a lot by who are using the cell phone. I'd like to enlighten on cell phone hand syndromes. Okay, these cell phone hand syndromes, what exactly cell phone hand syndrome means? So before we used to tell it as cubital hand syndromes. Nowadays we are telling it's a cell phone hand syndrome. So in this, what happens is by using your cell phone a lot, by keeping this to your ears, and here what happens, your nerve will be stretched. And here we have got a very important nerve called ulnar nerve. This starts from here, it travels this way, it passes behind this bone. You can see the bony prominence. It passes through behind this bone. It goes straight, it comes front and goes, and it will be supplying these two fingers. And the main purpose of that nerve is it is responsible for getting the sensations this side and motor power on your hands. So by keeping your cell phone, using your cell phone a lot, it causes a tension over your nerve. Your hand will be your nerve will be tension free when you keep your hand just below 45 degrees. When you tend to move your hand more than 45 degrees, more and more you keep your hand, you'll be flexing your hand, the more tension will be created in the nerve. And here what happens, here there will be a tunnel. Tunnel means a small hole. From this hole the nerve will be passing. When you bend your elbow, what happens? The tunnel size will be decreased and the pressure on the nerve will be increased. And moreover, what happens to the nerve? There will be a blood supply. When you bend a lot, what happens? The blood supply to the nerve also will be decreased. When the blood supply to the nerve decreases, the nerve starts becoming swollen and it causes pain, tingling, pins, needle sensations, aching pains over your hand. And sometimes you can feel there is a weakness inside your hand muscles. You can feel the weakness in the hand muscles. These should be identified as the earliest. If we neglect these symptoms and if you continue prolonged using these cell phones, there can be an irreversible change. And initially, these will best respond with simple painkillers, simple exercises, and if you are neglecting, so sometimes it may lead to surgery also. How to tackle this cell phone hand syndromes? First, whoever is suffering with the cell phone hand syndromes, first we need to identify for what reason he got these problems. So this problem will we get only with the usage of cell phone? This is one of the causes. Sometimes what happens, so most of the time we'll be using the systems. While using the systems also, you'll be bending your elbow. This can also cause these symptoms. And other thing, the many of us will have a habit of keeping your hand like this and sleeping. The most of the time, the people will suffer with the left hand because right hand they'll be doing some work, with the left hand they'll be using phones. So it's not mandatory that they will get for a left hand side only. They can get on the other side also. So here we need to identify the cause, whether he's a software professional, whether he is overusing the phone, or his sleeping postures. When he's sleeping, whether he is keeping his hand like this is bent and keeping his hand under his head and sleeping. So we need to identify the root cause and we need to educate the patient regarding that. If he is using a cell phone a lot, so first we need to tell a patient if he's getting the symptoms over the left hand, and we'll tell a patient to use the phone with an other hands, and we'll educate a patient to keep it in a speaker and talk over the phone. So you should not bend a lot. You should on the speaker and you should talk, and sometimes you should use earphone sets and you can talk. And next thing you can is, if you are using a system, sitting, you are using and you are typing the system, this is causing a problem. Sometimes we'll modify the work style. So we'll ask a patient to stand up, and to do the work. While stand up and doing the work, what happens? Instead of bending his hands, he start keeping his hands straight. This causes a less pressure on his hands. And the next things, while he is doing this, sometimes what happens, these muscles are more prone for getting tightened. So he has to do some stretching exercises in between to stretch these muscles and to stress these muscles. So this thing, one thing he can do. And next thing is the simple exercises he need to follow while he's having an early symptoms. The best exercise he can do is a now flossing technique. Now flossing technique means it's an Allan now flossing technique. So the simple thing we can say is just he can keep his hand like that. Okay, he can keep his hand like that. Okay, and after keeping his hand like that, just he can take his hand to close to his head. While he is taking his hand close to his head, he will get a symptoms. Whenever he is getting a symptoms, just he has to move his hand, which eases his symptoms, and slowly he has to move his head to the same side and try to rotate. So he has to repeat this maneuver. This is called now flossing techniques, and this is for education purpose. Sometimes, and all the patients are not the same. Each and every patient is different. We need to evaluate thoroughly, and we need to decide whether he is suitable for now flossing or not. He has to progress till here, and slightly he has to rotate. It isn't completely. We are treating the issue. So now, once he is not responding with the now flossing techniques, then it's the time to see a doctor, where they'll be giving some anti-inflammatories. If he's not responding with the anti-inflammatories and exercises, and sometimes at very rarest of the rare cases, they might go for surgery or surgical decompression to relieve